It's Thursday. That means a virtual house call from KRDO News Channel 13's Dr. John Torres. And Dr. John joining us via Skype today. How's it going, Dr. John?
It's going great. How are you guys doing today?
We're doing great. Good to see you, as always. The Colorado Department of Health and Environment says 11 cases of tularemia have been reported thus far this year. There were 16 cases in all of last year. The highest number was 20 in 1983.
So we want to know, Dr. John, what exactly is tularemia and how are people getting it?
You know, this has a lot of experts concerned, especially public health experts, because the numbers are expanding so much this year. Tularemia actually comes from handling animals, especially rabbits, and that's why it's called rabbit fever. But it can also come from other sources, mainly soil, water, even inhaling bacteria that gets kicked up into the air. Matter of fact, the people who've gotten it were doing yard work. They were not handling animals, and that's the thing that has some people concerned. Symptoms include fevers, chills, a headache, muscle aches, joint pain. It goes on and on. Vomiting, dry cough, difficulty breathing. Those are when it starts getting a little more serious. The disease is treatable with antibiotics, but you definitely want to get it treated early, because the earlier it's treated, the easier it is to treat. In order to avoid getting it, here's some things you can do. Wear gloves if you're gardening or landscaping, and then wash your hands after this type of activity. If you're out there mowing or doing yard work, wear a dust mask, because again, it can get up into the air. And this is one of those things that sounds kind of gross, but don't mow over animal carcasses, because that too can kick up that bacteria. And when you're outside gardening or mowing, don't go barefoot, don't wear sandals, because the insects can bite you there and they can cause you to get tularemia. And definitely if you're outside, wear insect repellent, extremely important.
So the people who should be most concerned, people who are spending a lot of time outside doing this landscaping type of thing?
Exactly. Those are the ones that should take a look at themselves. When I tell people, if you're starting to get flu-like symptoms in the summer when it's not flu season, that's when you want to pay extra attention. And if it doesn't seem to go away, if it starts getting worse, be seen fairly quickly, because this thing can catch up on you really fast.
All right. Well, two top nutrition experts say low-fat food may not be so great after all, and go ahead and eat fat. I like that directive.
You like that one? Well, you know, for the past 30 years, we've been told to eat a low-fat diet. That's what everybody's been telling us constantly. But these nutritionists are saying we've been getting the wrong kind of message, because those low-fat foods often come with a high amount of added sugar, and that's causing some health problems in and of itself. Tufts University doctors wrote an editorial in the Journal of the American Medical Association. That's one of our big journals. They say it's not the total fat intake that matters, it's what kind of fat you eat. The fats that are found in nuts, fish, olive oil, things like avocados, they're actually good for you. They lower your risk of heart disease. They lower your risk of cardiovascular disease. But this is not a free pass to eat all the fat you want. This is not a reach for those cheeseburgers and french fries just yet. You want to do that in moderation. So the best approach is to get choosy, eat more healthy fat, and roll your cart right past those low-fat options that end up giving you a lot more sugar. So again, become label readers in moderation.
All right, Dr. John. Well, it is summertime, and there are a lot of kids are heading to the pool, trying to cool off. And nearly everyone assumes that the chlorine in the pool, that's what makes your eyes red, but that's not the case at all, is it?
So gross.
And this story's a little bit gross, so here we go. You know, it turns out the Centers for Disease Control says it's actually urine binding with chlorine turns into a chemical called chloramine.
All
right,
Dr. John's sound is getting a little distorted there.
Yeah, some issues with the Skype, which for those who use Skype are...
The story is so gross it just killed the mic, I think.
Yeah, so basically what makes your eyes irritated is people urinating in a pool. And
Yeah.
the combination of the chlorine, and that's what... it also has been linked to respiratory problems among some swimmers. The CDC also said its report that the chlorine smell of pools isn't actually what you think. It says what you smell are actually chemicals that form when the chlorine mixes with body fluids along with sweat and dirt from swimmers' bodies. These chemicals, not chlorine, cause your eyes to get red and sting and make your nose run and make you cough. So take a shower, I guess, is the best advice after swimming.
I probably could have lived the rest of my life without knowing that.
Dr.
I'm
John,
perfectly happy.
just nod your head if you agree with everything we just said. Thumbs up from Dr.
He's
John.
been silenced. No talking about this chlorine business.
Well, thank you for joining us, Dr. John. Of course, Dr. John will join us on Monday, hopefully in studio, and his voice will be intact for
We'll
Medical
have some
Monday.
better non-gross stories.
We'll talk about maybe more pleasant things.
Yeah, hopefully. We'll be right back.